To give you an example, I think as an obstacle, and I mentioned earlier physical effort as one of the principles that are part of adherence engineering as a conceptual framework. It's basically, we identified a number of principles that we think are psychologically solid because they are based on research in psychology as governing behavior or shaping behavior. One of them is, we know, for example, that physical effort is an important variable and people try to minimize physical effort. Now, how can we implement a solution that gets us higher adherence and reduces physical effort? So the idea was people do not adhere because adherence might be physically effortful. So one component in our kits is a little pocket with hand sanitizer. Now, hand sanitization is really important prior to performing the procedure. Now, how it is done normally without the kit is people have to walk over to the wall dispenser, perform hand hygiene, walk back, and have to do it during the procedure one more time. So this is covering quite a bit of distance. And when I say quite a bit of distance, it ranges between 5 and 10 feet. So it's not huge individually, but it adds up if you do this procedure many times a day. Now, to demonstrate how effective, reducing physical effort in this context is, what we did was we added this little pocket of package of hand sanitizer into the kit, and we increased our hand hygiene adherence to almost 100% after implementation. So people now did not have to walk over to a wall dispenser, but just had it presented in front of them. Another motivation we think plays an important role is waste and reduction of waste. So if you have a kind of package with hand sanitizer in front of you, you are less likely to waste it. You're actually using it because it is there, it's present. And so that also may have been a factor driving nurses' adherence to performing hand hygiene prior to performing the dressing change. So that's just one example. Another example, for example, is affordance. Affordance is a principle that has been identified for quite a while. And what it really means is you design an object in such a way that it provides you with opportunities to interact with this object the way you, as a designer, want people to interact with it. A good example is a coffee mug. Coffee mug has a handle, and you can use this handle or can use the coffee mug by holding onto the handle. It's creating an affordance. That's the most intuitive way of holding a coffee mug. There are many other ways, but that's how we reach out for the coffee mug normally. So one of the things we did was we created very high intuitive accessibility of the kit by creating tabs, color-coded tabs that allow you, that indicate where to open the kit. For example, we used, as the kit has 3 phases that are part of the task, and each of the phases uses different requirements. And one of the ideas was during the sterile phase of central dressing change, you basically have to set up a sterile field. And so one thing we did, and again it creates adherence, is you use the material that contains pockets with the individual components that you use during the procedure. You use this as the backdrop, as the sterile field. So you open it up using tabs, and there you have a sterile field already laid out, because all of the components, including the carrier material, the pockets, has been sterilized. And then you basically can work your way through the procedure pocket by pocket by pocket, which provides guidance, which is another principle, to guide people about how to perform the tasks. So task intrinsic guidance. And by following these principles, the idea is that it makes the task very easy, cognitively low demanding, physically low demanding. It provides a lot of structure, and as a consequence, people can adhere. They are less likely to forget individual steps because they have to rely on memory, for example, and we're not very good in remembering long lists of items. And overall can perform this task more effectively with regard to the protocol, and as a consequence safer and with fewer negative outcomes for patients.